Hi, everyone. Today we'll be talking about managing mental health during the pandemic. The presentation is by Lindsay, Amber, and I. Our preceptor is Dr. Waters, and I hope you guys find this presentation enjoyable as it's very relevant to the current topic. Just to start off the presentation and give some background evidence, at the end of 2020, the New York Post composed a study in which they looked at health-related disorders, comparing March and April 2019 and comparing it with 2020. It's interesting to note how high the percentages increased, such as overdoses increased to 94.91% from March 2019 to March 2020. And from April 2019 to 2020, it increased from almost 120%. This is all due to COVID, and the reasoning behind this will be discussed later in the presentation.
Why is this occurring? There are many factors contributing to the mental health crisis caused by the COVID-19 pandemic. First one was isolation due to quarantine. Some people are living alone, unable to get out of their houses and see other people. Others are stuck in the house with the same people all the time. People are lacking social interactions such as in-person meetings with coworkers, going to family gatherings, and spending time with friends when you're having a bad day. Fear of personal safety and safety of loved ones from being infected by COVID-19 is also a cause. There's also financial hardship such as unemployment, pay cuts, and business closures. There's excessive exposure to news and media, which has actually been shown that watching 2 hours or more per day of COVID-associated media is related to increased risk of anxiety and depression. There's disruption of established routines, such as going to the gym. There's PTSD from COVID and working with COVID patients, and in fact, healthcare workers are some of the most impacted victims of the COVID-19 mental health crisis. There's loss of loved ones due to COVID-19. There's uncertainty about the future, and while vaccines are rolling out and more are being approved, there is still no guarantee that this will be the last of our COVID-19 worries. These are just a few of the things that touch the surface about why this mental health crisis is becoming such a big problem. Why are these numbers alarming? Mental health issues created during the last year will likely last years after the pandemic has ended. Many people have developed anxiety, depression, PTSD, substance abuse disorder, and have even thought of suicide. A study was done to try and predict the long-term impacts of COVID-19 mental health in a little over 1,500 individuals through social media surveys. Surveys evaluated current symptoms of depression, anxiety, acute situational PTSD, prior mental illness, COVID fears, suicide risk, and substance abuse as a coping mechanism. These symptoms were evaluated at baseline and at a 5-month follow-up. As you can see to the right, there is an alarming increase in suicide risk for every category that patients were stratified into, with a 12 times increased risk of suicide overall from baseline. Factors that contributed to this large increase were prior mental illness, increased anxiety, lack of social support, use of substances to cope, and hopelessness. But mental illness does not just mean suicide. Long-term mental illness will not just go away once the pandemic is over. Often, anxiety, depression, PTSD, and substance use disorder are lifelong battles that work hand in hand with each other. The short-term worsening of these illnesses could significantly decrease the quality of life of people who are severely impacted by these illnesses.
So why is mental health important? Mental health affects our emotional, psychological, and social well-being, which determines the way that we think, behave, and feel. It also determines how we relate to others, handle stress, and make decisions. Mental health is relevant at each life stage, including childhood, adolescence, and adulthood. Positive mental health also allows people to cope with their stresses, work productively, and be able to contribute in a meaningful way to their lives. And how can we help as pharmacists? Nathan Painter, an ambulatory care pharmacist, recognizes he has been provided the opportunity to expand his role as a pharmacist during the pandemic. He states, "I can be more deliberate about the depression and anxiety screenings, and I focus more on self-care strategies." As pharmacists or even student pharmacists, it's important to acknowledge the spike in depression and anxiety during the pandemic. It's also essential to be receptive to patients and recognize that not one size fits all. Flexibility and working with patients on an individual basis are two important skills that pharmacists must practice to put patients at the center of care. Pharmacists must also be able to determine the point when patients need to be referred to a specialist, when the care they can provide is outside the scope of their practice. There has also been a lack of access to physicians during the pandemic, which has led to more patients seeking out information and asking questions to pharmacists who are living up to their name of the most accessible healthcare providers. This is giving pharmacists the opportunity to build trusting relationships with patients, which leads to patients feeling more comfortable picking up prescriptions and asking questions. Due to increased demand for mental health resources during the pandemic, Walgreens began training all of their health outcome pharmacists in mental health first aid in May of 2020. This specialized training aimed towards identifying warning signs, working with other providers, and finding gaps in care or treatment related to mental health. With the rise in depression, anxiety, PTSD, and other psychiatric disorders throughout COVID-19, pharmacists are at the forefront and playing an even bigger role in patient care. So how can you manage your mental health? It's important to prioritize your health as much as possible. Spending the entire day in your house or apartment can be mentally draining, so going for a walk, listening to a podcast, meditating, and stretching are some ways to help escape. Focusing on something other than work or school will also boost your mood and can motivate you to get work done. Making time for yourself to unwind at the end of the day is also very important. It may be tempting to scroll for hours on your phone, but this can negatively affect your sleep habits and you will feel more tired the next day. Instead, healthy ways to unwind include reading, listening to music, journaling, or doing yoga. Connecting with others is human nature. Although many feel isolated in their homes right now, it's important to reach out to family and friends as much as possible through Zoom, FaceTime, or even going on a socially distanced walk. Since everyone is home, this means more people have had to cook at home more than often before. Now is the perfect opportunity to plan meals that will healthily fuel your body and mind. The goal is to be more self-aware and conscious of the food we are putting into our bodies.
There are many benefits to treating mental health, and these are just a few. People with mental illnesses are 40% more likely to develop comorbid heart disease or diabetes. They are also more likely to develop other chronic illnesses such as cancer and substance abuse disorder. So by improving your mental health, you will also improve your physical health. Sleep disturbances are often associated with depression and anxiety, and so by helping your mental health, you will also get better sleep. You will also have increased productivity and ability to concentrate, as depression and anxiety can have significant effects on how your brain functions in normal activities, making it harder to focus on school or work-related tasks. You'll also improve your social relationships. People with mental illnesses can tend to socially isolate themselves from friends and loved ones. In this time with so much isolation to begin with, it's important to have those social interactions. All of this will lead to an overall better quality of life.
And these are some resources for mental health that we thought were important to include on the presentation. We'll start this off with Student Health and Wellness. Student Health and Wellness is available for the Yukon community. With the pandemic, all services can be virtual, but there are certain in-person services going on in the Arjona building. It is very easy to talk to someone. All you have to do is fill out a pre-evaluation form online, and you'll be advised to make an appointment with the counselor who will help you. Student Health and Wellness also plans events such as yoga, other de-stressing events, which will help students with mental health cope with their stress and do well in their exams. There's also Reach Out Connecticut, which is open to anyone who calls and will connect you to any health services around the state of Connecticut. It's not a 24/7 program, but they do have specific hours that you can call, and it might not be beneficial in a crisis. There's also the crisis text line, where you text home the 741-741, and you'll be instantly connected to a crisis counselor who will try to calm the person down. I found this one interesting because it may target younger people who would rather text than talk. The crisis line is open 24/7, so people can text anytime they are in a crisis, and it might be beneficial for people who do not want to speak to someone, but instead text the counselor. And finally, the National Suicide Prevention Hotline. It's a 24/7 national hotline where people can call anonymously to speak to a crisis counselor. In June 2020, Congress agreed upon using a 3-digit number, 988, due to the increasing number of mental health crises. 988 will be effective in July 2022, and it'll help more people get into contact with a counselor instead of calling the long number that's on the National Prevention Lifeline. And we just want to thank you for your attention and thank you for taking the time to view our presentation. And I hope you guys found it helpful and useful trying to navigate through the pandemic.